Okay. Hi, Professor. So I'll be doing my head-to-toe assessment on my teddy bear. I have my equipment here, my Snellen chart, and this is the scan of the room. Sorry, kind of messy, been studying. This will be kept on because I've recorded this how many times now, and for some reason my phone keeps stopping. Okay. All right, so both are recording. Hi, may I come in? Thank you. Hi, I'm your nurse Charlotte. Provide privacy. I'm your nurse Charlotte, and I'll be doing your head-to-toe assessment today. Can I have your full name and your date of birth? Thank you, Mrs. Jones. Check wristband. Perfect. Okay. So, Mrs. Jones, are you currently in any pain? No pain. And do you have any allergies I should be aware of to food or medication? No? Okay. Thank you. And do you know what day it is? Do you know who the current president is? And do you know where you are? Good. So my patient is alert and oriented times 3. So I'm going to ask a little bit about how your typical mood is. Happy. And so do you normally wake up happy? Great. Okay. So now I'm going to go ahead and perform hand hygiene. Okay. So I have my patient's vitals here. I'm going to put this in the camera. Put this in the other camera just in case. Okay. So I'll be taking my patient's blood pressure on her left arm, and her blood pressure is 118/68 mmHg. Heart rate is at 68 beats per minute. Respiratory rate is at 16 breaths per minute. Oral temperature is at 98.6. And her SPO is at 99% in room temperature. Good. All right. So now the first thing I'm going to do is I'll be checking my patient's cranial nerve 2, and I'll be using the Snellen chart test for that. So I'll be standing 20 feet away from my patient. Mrs. Jones, do you use any corrective lenses? No? Okay, good. So I'm going to instruct my patient to cover one eye at a time so I can check her vision. And she's going to try to read to me how far she can read in the Snellen chart. So my patient was able to read at 20/25. And so that means what my patient could read at 20 feet, somebody with normal vision can read at 25 feet. Thank you. Great. So now I'll be checking Rombergen gait. I'll ask my patient to stand up, and I'm going to ask her to take us a couple steps forward, and I'll be assessing her gait. Good. And so now I'm going to ask my patient to stand still with both arms to the side, and she's going to cover her eyes, and I'll be monitoring her for 20 seconds, and mild swaying is a normal finding. Great. Thank you. So now I'll be performing the whisper test. So I'm going to ask my patient to cover one ear, and I'll be in her opposite ear, and I'll be 2 feet away. So go ahead and cover your ear, Mrs. Jones, and I'll be 2 feet away from my patient, and go ahead and just repeat back to me. I love bananas. Good, thank you. And patient will cover the opposite ear. Nurses rule. Great, okay, thank you. So now I'll be testing the cranial nerve 1, which is the olfactory, and that is to assess her sense of smell. Now, hand hygiene. I'll be taking this, and I'm going to ask my patient to close her eyes and cover one nostril, and she's going to take a whiff, tea, and then cover the other nostril, take a whiff, and it's coffee. Okay, thank you. All right, so now that that's done, I'm going to go ahead and move forward with my assessment. Mrs. Jones, is it okay if I touch you? Thank you. So I perform hand hygiene. So with the head, I'm going to do a general inspection of her head, her scalp, and then I will go ahead and take my pen light. And I'm going to look inside the ears. Patient has no abnormal findings. Cerumen is minimal. No obstruction, and tympanic membrane is pearly gray. So the opposite ear has similar findings, and a tympanic membrane is pearly gray, no obstruction, and minimal cerumen. Good. Now I'm going to ask my patient to just look straight ahead. And I'll be checking for her pupil constriction. And so go look straight ahead, and I'll be checking for pupil constriction. And I'll be checking for consensual constriction. Good. I'll be assessing patient's cranial nerves 3, 4, and 6. So I'm going to ask my patient to follow my pen light, and I'll be 12 to 18 inches away from my patient. So I'll be performing the 6 cardinal gaze. And during this time, I'll be assessing if my patient has any signs of nystagmus. And I'll be checking for accommodation. Good. Okay, so now I'm going to ask my patient to tilt her head back a little bit, and I'll be inspecting the nose. So nose has no abnormal discharge, no signs of polyps, and no signs of deviated septum. I'm going to ask my patient to open her mouth, and I'll be inspecting the oral mucosa, and oral mucosa is pink and moist. All teeth are intact. Tonsils are grade 2, and if you can lift your tongue up a little bit, frenulum is midline. Okay, go ahead and close your mouth. Okay, so now I'm going to ask my patient to turn her head to her left side at a 45-degree angle, and I'll be checking for any signs of JVD. No signs of JVD. Good. I'm going to put that down. Hand hygiene. Now I'll be palpating her carotid artery, one at a time. Good. Okay, so now I'll be checking her lymph nodes. I'll start with her occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, and supraclavicular. Okay, good. Okay, so now I'm going to put my hands on my patient's shoulders, and I'm going to ask her to shrug. All right. Now I'll be inspecting my patient's skin on her arms for any signs of discoloration, making sure that her skin's intact. I'm going to